Hey y'all, welcome back to Sex Education Nation. Let's talk about the Depo shot. If you're a person that doesn't like to get shots, then this is definitely not the birth control option for you. You have to get a shot about 4 times a year or every 3 months. The cool thing is that you can do it at home or you can do it at the doctor's office. Similar to the birth control pill, you're taking synthetic hormones which stop ovulation, specifically the synthetic hormone progestin. If you watch my birth control series, you know that when you stop ovulation, certain things happen to your body. It can kind of make you feel numb. It can affect motivation, concentration, memory. But if you don't like taking a pill every day, then this is a great option for you. It's very effective in preventing pregnancy, but of course it doesn't prevent STDs, so you would still need to use protection in that way. And of course, making sure you're getting tested regularly. I remember I considered getting the birth control shots, but my doctor said that I might gain weight, and so that kind of turned me off to it. So if that's something that you don't want to happen, then take that into consideration. Other side effects may include nausea, depression, sore chest area, headaches, and spotting between periods. After taking the shots for about a year, a lot of people's periods go away altogether. But your period would go back to normal if you stopped taking the shot about 4 months after your last shot. The most important thing about the Depo shot is that you get it on time. You have to set a reminder in your phone, in your calendar, or whatever. I think that's all, but if you have any questions, please let me know. Hey friends, welcome back to Sex Education Nation. I am here today to talk about the birth control patch. If you don't want to take a pill every day, or get a shot every 3 months, or get something inserted into your uterus, this might be a good option for you. So you put the patch on your belly, butt, or back. It can't be anywhere where it might rub off by tight clothing. Also, you want to avoid being in the water for more than 30 minutes. But let me get into what the patch does. Similar to the birth control pill and the birth control shots, you are getting synthetic hormones from the patch, and specifically estrogen and progestin. The patch stops ovulation, and it also makes the mucus on the lining of your cervix thicker so that sperm can't get through. I've talked about this in previous videos, but when you stop ovulation in your body, certain things can happen. It may affect your moods. Sometimes it can cause brain fog, anxiety and depression, all that good stuff. Again, there is not enough research on how this affects growing bodies because ovulation is really important for our bone development, our brain development, our lung development. So if you're someone whose body is still developing, then I would definitely think about that. But other than that, the patch is pretty safe and very convenient. You want to keep it at room temperature away from sunlight when you're storing it. For it to work effectively in preventing pregnancy, then you have to make sure to use it correctly, so always remember to read that little paper that comes with it. And of course, if you're not sure about it working, then definitely use a condom. Also because it doesn't prevent STIs. So still make sure you're protecting against those, and of course, make sure you're getting tested regularly, especially if you have multiple partners. I hope this was helpful. If you have any questions, please let me know, and remember, safe sex is the best. All right, y'all, time to talk about the birth control ring. Let's get into it. There are 2 types, the NuvaRing and the Anovera. The NuvaRing is probably what you've heard more of. It lasts for up to 5 weeks. Change it about once every month. And yeah, it kind of just lives in your uterus. Like most birth controls, it has synthetic hormones, estrogen, and progestin. The Anovera lasts for about 1 year, but you're keeping it in for 21 days and you're taking it out for 7 days. So you will have to store it in a room temperature place away from sunlight, and you will sometimes have to wash it with soap and lukewarm water. For anyone who's had the NuvaRing or the Anovera, how are we doing? Because after watching The Business of Birth Control, I'm a little bit hesitant to be all gung-ho about the ring because of blood clots. The FDA released a study showing that NuvaRing users are at a 56% increased risk of blood clots. Manufacturers have over 700 lawsuits against them because of blood clot related issues. If you're someone with high blood pressure or a family history of high blood pressure, this is not the birth control for you. There's an increased risk of high blood pressure, strokes, and heart attacks. If you're a cigarette smoker, especially if you're a smoker over the age of 35, then you're at an increased risk even more. There's also an increased risk of cancer, And if you're a person with diabetes, specifically the type of diabetes that affects your kidney, eye, nerve, and blood vessel, you have damage there, then you should not take this birth control. I find it so interesting how there's all these risks, but the first line that you read about with the birth control ring is that it's safe and convenient. Safe for who? The birth control ring also stops ovulation, so remember that also comes with its own risks. Moral of the story is be careful and always advocate for yourself at the doctors. Your health is number one. Please comment any questions, or if you have any experience with the birth control ring, please comment your experience. Please share this with a friend and remember to follow if you're not already. Some of you asked for information on the IUD, so here we go. We have the hormonal IUD and we have the copper IUD. IUD stands for intrauterine device. So yes, it's being inserted into your uterus. Some people had a really awful, painful experience with the IUD. They didn't like it, but for me personally, I love my IUD. I really like that I don't have to worry about it. It's just there. There are 5 different brands of IUDs that are FDA approved. 4 are hormonal. There's the Mirena, Kyleena, Liletta, and Skyla. And then for the non-hormonal, you have the Paragard copper IUD. What the IUD does is stops the sperm from reaching the egg. Apparently sperm don't like copper, so that's how the copper does it. And then for the hormonal one, this might sound gross, but it thickens the mucus that lines the cervix so that sperm can't get through. Another really great thing about the IUD is that it can last for 7 to 12 years, depending on what brand you get. And lastly, I recently learned that the IUD can actually be used for emergency contraception. So if you have a little accident, you can get the IUD within 5 days of that accident, and it should work. At that point, you can keep it in or take it out. And you can take your IUD out at any time if it's painful or if you just don't like it. I'm going to go into more detail about the hormonal IUD, so make sure to follow. Any questions? Let me know. I'm going to tell you why I chose the copper IUD. I was on birth control pills for about 4 years before, and my mental health was not good. I felt like I had a lot of mood swings. I didn't like having to take a pill every day. I just didn't feel like myself. So when I heard that there was a non-hormonal IUD, I was like, please, let me do that. As soon as I stopped taking birth control and I got the copper IUD, I actually felt like myself again. My body started naturally producing my hormones again. My mental health got better. And I didn't have to worry about taking pills every day. So if you're thinking about getting on a birth control, you do have a lot of options. I would recommend the IUD just because I had a really good experience with it, but of course, not everyone does. It depends on your body. Finding the right birth control is kind of trial and error, unfortunately. 100% talk to your doctor, ask about side effects, ask how it's going to affect your body, do your research, and of course, if you have any questions, please let me know. And remember, safe sex is the best. Hey friends, let's talk about the arm implant birth control. Some of you asked for this, so let's get into it. The arm implant, or the brand name is called Nexplanon, goes into your arm. It's about the size of a match. It releases the synthetic hormone progestin, which makes the mucus on the lining of your cervix thicker, and it also stops ovulation. You might know from watching some of my previous videos that stopping ovulation does have some side effects, especially for growing bodies, so feel free to check out my old videos if you haven't already. The really cool thing about the arm implant is that it's one of those birth controls that you get and then you can forget. It lasts for 5 years. It's very effective in preventing pregnancy because there is very little human error. If you're trying to have a baby, you can take the implant out and it pretty much immediately lets you be able to have children again. But of course, every body is different. And remember that these synthetic hormone birth controls are great at preventing pregnancy, but they're not great at preventing STIs. You would still need to wear a condom, and of course, you should be getting regularly tested for STIs, especially if you have multiple partners. As for side effects, there's very similar side effects to other birth controls like nausea, weight gain. The biggest one is light spotting within the first 6 to 12 months of getting the implant. But then it seems like most people don't get a period after the first year. Correct me if I'm wrong if this wasn't your experience. So yeah, that's basically it. If you have any questions, let me know. Please feel free to share this with a friend, follow, and remember, safe sex is the best. We've got a pro tip over here for the birth control patch. If your skin easily gets irritated from adhesives, do not get the patch. This person had negative reactions to it. Remember, every body is different. You can find the right birth control for you, but sometimes it takes trial and error. If anyone else has any pro tips about the patch or any other birth control, feel free to comment below. And thank you for this comment. I feel like every time I do research into birth control, I always learn more horrific things, and this is one of them. The birth control shots can affect your bone density, so that's fun. Moral of the story is every body is different, but whenever you're putting synthetic hormones into your body, you gotta be careful because there are risks. Thank you for this comment. Fun fact I just learned, 1 in 10 people with a uterus get endometriosis. So shout out to endometriosis medicine and the birth control shots for lowering people's bone density. What are things that help with low bone density, you ask? Here are a few. Definitely making sure you're getting enough calcium. And remember, calcium doesn't always need to be from milk and stuff like that. It can also be from green vegetables and beans and not smoking cigarettes. Also not drinking too much, but that's for everyone.